Khwezi Holdings and its business partners have introduced a digital record-keeping tool that enables companies to keep records of its screening activities for access control and contract tracing purposes. The idea is to reduce the need of paper-based processes, and it also is used to address the mandatory guidelines as set forth in the COVID-19 Occupational Health and Safety measures as mandated by the Minister of Employment and Labour on the 28th of April 2020. These measures include symptom screening and record keeping, which enables for effective contract tracing. The tool is available on any web browser, from a mobile phone or a PC for that matter. The user would simply choose their language. They could fill out their details. I've taken the liberty to use Lebogang Sabaya's contact details. They don't fill out their body temperature. This is only done at the end when the officer or person doing the screening will take the body temperature, and we fill out the details then. So next. Do you have any of the following symptoms? Do you have a fever, a new or existing cough, any difficulty breathing or shortness of breath, loss of taste or smell? You have a sore throat, a headache, body aches, redness of eyes, or none of the above? Simply go to next. Have you had any close contact with a confirmed case or probable COVID-19 case within the past 14 days? Yes or no? Have you had any respiratory conditions with unknown diagnosis in the past 14 days? Yes or no? Have you had a family member living with you that has been affected by COVID in the past 14 days? Yes or no? Have you worked in or attended a healthcare facility where patients with COVID-19 infections are being treated? Have you travelled internationally within the past 14 days or been in contact with somebody that has travelled internationally within the past 14 days to high-risk COVID areas? Yes or no? Have you had close contact with a person with acute respiratory illness or who has been outside South Africa or travelled to a high-risk area within the past month? Yes or no? Were you tested for COVID-19 in the last 14 days? Khwezi Holding has the responsibility to ensure a safe and healthy environment for its employees or visitors and reserves a right to measure your body temperature at the entrance to its premises. You will not be allowed to enter the premises if your body temperature is above 37.5 degrees. If you refuse to take the test. Do you consent that your body temperature will be taken via non-contact methods prior to entering the premises? Yes. This assessment serves merely as a remote screening and contract tracing tool. The content of the screening tool does not constitute professional or medical advice or replace the need for professional and medical advice. If you are concerned about your state of health or display flu-like symptoms or have come into contact with someone who has COVID, please contact the COVID 24-hour hotline. By clicking the submit button below, you expressly acknowledge the above statements and agree to the terms and conditions, which the user can click on over there and it will open the terms and conditions. If they agree, they simply submit the form. Submission has now been received, whether the user sent it from a mobile device or from a desktop device. It must be noted that the submission can be received prior to the person even arriving at our offices to make the entry into the offices a lot faster. The next step is basically gets handled at the security checkpoint and the verification of that person's body temperature, which I'll now show you a demo of what that will look like. Okay, the verification tool is an extension of the COVID screening app, which is used at the entry point. This dashboard is managed by the person that is allowing the entry into the business or not. At this point in time, your visitor will be screened and the verification of their temperature will be logged. So Bongi, for example, if I click on log verification, it will ask me to take their temperature. I will then enter the temperature, confirm it. There you can see the date. It will put a date and a timestamp on this particular person to allow for auditing. I can see that Dorcas failed her entry. There could have been reasons for that. If I click on the hot link, it will show me that during her questionnaire, this particular user answered that she has an existing or a new cough. She has had close contact with a confirmed or possible COVID-19 case within the last 14 days. It is at this point that the person managing the entry can deny access to this person and obviously make a formal decision on what needs to happen. If I go back to my screening tool, at any point in time, this dashboard, because it is web-based, I can access the reports using in the format of an Excel or a PDF format. I will show you what the Excel format looks like. And there you can see from a contract tracing perspective, it is easy enough for us to find, because I have a detailed audit trail of all the people, whether it is staff or visitors to our organization. I can see who's been coming and going through the organization over a period of time. I can see the same view for a PDF format, and that's what the PDF version will look like. Thank you for your time.